Today is International Aspergers Day, and to tell us more about the condition, we welcome our resident GP, Dr. Jenny Smiley. Welcome to you.
Hi, thank you.
First of all, what is Aspergers Syndrome? It's
a collection of symptoms. It's part of the autism spectrum of diseases, and it's really a behavioural condition in many ways. It's a condition that people are born with, and they process information a bit differently to the rest of us. So it involves different ways of communicating, different ways of reading social signs, so that people with Aspergers syndrome may not pick up a cue that because you're frowning, you're not pleased with the way they're behaving. And if you said to someone with Asperger's syndrome, oh, get lost, they may literally try and go and get lost. Just not pick up on those fine communication nuances, but they can be very bright.
Now, I've heard that it referred to as a disease, but it certainly isn't a disease, is it?
No, because that implies that you can catch it and that you can cure it. It's something that people are born with and they will have all their lives, and it's a matter of learning to manage it.
How is it diagnosed?
Usually it takes a while because it changes. Behaviours that people with Asperger's syndrome can have can be quite normal in all of us if they occur occasionally. It's when those things occur all of the time. So the need for routine and getting very distressed if there is no routine, and that constant inability to read proper social cues. We'll all have good days and bad days, whereas with Asperger's syndrome there isn't that learning process that occurs as we get older. And so in little children their behaviour may not seem too bizarre or too odd, but people become progressively perhaps a little bit more odd as everyone else is growing up and learning how to behave.
So is it like autism in that there's a spectrum? You can have someone that's severely affected with Asperger's and someone who is mildly?
Absolutely, yes. And the milder cases are harder to diagnose. Obviously the more extreme the condition, the earlier and the easier it is to diagnose. But then the harder the battle to help that person assimilate happily into society.
Now, I'm pronouncing it Asperger and you're pronouncing it Aspergers. Is there a correct way?
No.
Now, tell me about obviously children at school, the effect of what kids have on them would also have an effect on how they react?
Very much. And so making the diagnosis is good because then we're able to recruit help to explain to teachers, to explain to other children that we're all different and that we all have different needs. And so we can then work as a team to get a good outcome. And that's really important because if people with this syndrome are in a supportive and inclusive environment, they can do very nicely at school, in the workplace. They get married, they can have children and live happy lives.
And they could improve? It's not something that once you're severe, that without help that you can't actually improve?
No, it's about a learning process, so that actually using something like cognitive behaviour therapy, teaching people with this syndrome how to react in social situations, just taking them through different scenarios and teaching them how they could have done it better, and doing that over and over again. Things that perhaps lots of children and adults will learn naturally without even thinking about it has to be broken into small steps and taught to people with this condition.
Thanks for bringing us aware of it. I think it's really important, isn't it, that people react the right way?
Absolutely, and to be accepting of each other with all of our differences, because we're all a little bit odd.
Yes, just some of us have got a name for it.
That's right.
That's great. Thanks so much, Dr. Smiley. We'll look forward to seeing you again
Terrific.
soon.
Thank you.
Now, we have more details about Asperger's syndrome and the details of their support network on our website. And of course, the best place to start if you're not sure is to consult your local GP. And now Mel has some good news about achieving a trim body.